At the University of Minnesota, we are driven to discover. The unique opportunities for faculty research at our School of Nursing include the care of older adults in gerontologic nursing, nursing and health informatics, and mental health. We are also committed to ensuring that the discoveries are translated and become part of affecting actual quality of care.
I've been working for 20 years on raising awareness and improving outcomes in patients with peripheral artery disease. We've been exploring a novel intervention that is, instead of walking exercise, aerobic arm exercise. That piece could translate for people who have very severe disease, have a lot of pain with walking. The thing that's beautiful about the School of Nursing is that there are so many faculty who have expertise in one area and they can translate that to somebody who's working on a project in another. So the goal is to partner with communities to make both providers and the public aware of peripheral artery disease, and then to provide interventions, specifically exercise interventions, to help improve the outcomes for these patients.
My research focuses primarily on Alzheimer's disease and long-term care, and specifically I focus on family care for people with Alzheimer's disease or related dementias, how family caregiving changes over time. The Memory Care Clinic really is a very unique nurse practitioner-led clinic that helps families as well as people with memory loss help manage their dementia more effectively over time.
We have a number of cognitive tests. Those are thinking tests that we can do with you.
And laid on top of the nurse practitioner-led care management piece is also a very strong family support component as well.
The University of Minnesota School of Nursing is visionary. Big data is the future, so we are positioning ourselves to be leaders in that future. We're looking for the total message that the data can deliver to us. In other words, the data present the hypotheses and we test those hypotheses. It's a complete change in the paradigm. Big data research is already replacing clinical trials. It accelerates the translation of research into practice from a period of many years to instantaneously.
The Twin Cities area is a wonderful climate for translational research, literally a hotbed for medical innovation. The University of Minnesota School of Nursing is right in the middle of it. A number of our faculty are involved in a relationship we have with Optum Labs, which is a subsidiary of United Healthcare. Using their large database, we have faculty looking at the adverse effects of cholesterol-lowering drugs, determining specific predictive models for cardiovascular disease, developing different types of therapies for venous thrombosis disease, and so forth.
In psych mental health, we have an integrative approach to teaching. I think the future for psychiatric nursing is extremely positive. I think that we have turned the corner, or turning the corner on stigma. The University of Minnesota School of Nursing has positioned itself extremely well to educate new nurses in psychiatric mental health nursing. We have new models of care that we're testing out here, both integrative mental health as well as interprofessional team-based care.
The psychiatric mental health program and the integrative health programs through the University of Minnesota complement one another really nicely into the work that I'm trying to do. Really looking at the whole person, what they need in terms of mind, body, spirit in order to help their health and healing process.
As we look toward the future of a transformed healthcare delivery system and a transformed definition of health in the United States, the opportunities for nursing are pervasive. We are driven to discover.